Welcome to episode number 9 of Reimbursement Readiness, Business Tips for Wound Practice, that is presented by Kathleen and friends. I am so excited that Amiee Coriano agreed to allow me to interview her for the next few episodes. Today's interview will focus on how her company's ability to process compliant claims in a timely manner is dependent on the right wound or ulcer management professionals performing the right work in the right place of service. Now, in future episodes after today, we are going to discuss the work that Amiee's company must perform to help credential wound and ulcer management professionals with the payers. And we're also going to discuss answers to subscribers' questions about the contracting process. Welcome, Amiee. Would you like to say something to the subscribers before we begin the interview?
Thanks, Kathleen. I want to thank you for inviting me to discuss this important topic today. I hope our listeners find this information helpful to continue their services to their patients and the roles coders have within their organization.
Well, thank you, Amiee. Now, let's get started with today's interview. So, Amiee, in our first episode of Reimbursement Readiness, we discussed the importance of coverage, and the subscribers actually located, printed, and read LCDs that pertain to their wound and ulcer management work. Now, after the subscribers reviewed their pertinent LCDs, they sent emails to me which expressed their surprise that some LCDs stated that certain procedures were only covered when performed by physicians and other qualified healthcare professionals. Now, they asked several major questions, which I would like to have you answer for them today. The first question is, when an LCD states that a physician must perform the procedure, is coverage restricted to MDs? And the second question is, what is meant by the term qualified healthcare professional?
Both Medicare and the AMA, American Medical Association, state that the terms physician refers to doctors of medicine, doctors of osteopathic medicine, and doctors of podiatric medicine, while qualified health care professionals refer to nurse practitioners and physician assistants who are qualified to write the medical orders, to create and update the plan of care, and to perform surgical procedures necessary to treat the patient's wounds and/or ulcers. These professionals also coordinate care for their patients with other professionals and providers throughout the continuum of care. However, these professionals must comply with their state scope of practice regulations.
Well, that's very clear, Amiee. And now I have a very interesting scenario that I'm going to discuss with you.
Okay.
Our subscribers learn that the local coverage determinations often specify the types of wound and ulcer management professionals who can perform certain services and procedures. And I receive many emails from nurses who are certified in wound care. Although worded differently, every nurse described a similar situation, and they asked basically the same question. Here is the scenario and the question that I would like you to answer. I actually wrote the scenario out so I would not forget the points they made. So I'm going to actually read it to you,
Okay.
and then I'll ask you the question. The nurses have said, I have been offered a position with a mobile wound care company which provides care to patients in their homes, nursing facilities, and assisted living facilities. Because I am certified in wound care, the owners of the mobile wound care company want me to perform procedures such as dressing changes, compression wraps, reapplication of cellular and/or tissue-based products for skin wounds, reapplication of negative pressure wound therapy dressings, application of new disposable negative pressure wound therapy pumps, and so forth. But they don't want to send a physician or QHP with me. Now, I asked the company how they would bill for my service, and I was told that they would bill for the service under the name and the NPI number of the physician or nurse practitioner who ordered the service. And their question is that compliant billing? So, Amiee, as a practice management and coding and billing company, please tell the subscribers if that is compliant billing and if the nurses should accept those positions under those conditions.
I've heard that scenario before as well. And it's going to be quite a lengthy explanation for you guys. So mobile wound clinics can only bill for work performed in those places of services when the medical doctors, the doctors of podiatric medicine, the nurse practitioners, and physician assistants actually perform the work. A wound care certified nurse can accompany and assist those professionals with the patient's care, but the mobile wound clinic cannot send the nurse to the home and bill with the professional's name and NPI number. Even if the mobile wound clinic could bill for the work that nurses perform, the nurses could only do work that is in their scope of practice. For example, nurses cannot perform surgical procedures such as application of cellular and/or tissue-based products for skin wounds. Now, each state scope of practice for each professional group directly impacts patient treatment by ensuring that healthcare professionals operate within their level of training and expertise. For an example, an MD, nurse practitioner, or PA scope of practice allows them to treat wounds on any body part, but a DPM, their scope of practice in many states limits them to treating wounds on the foot.
Well, thank you, Amiee. Thanks for clarifying that. I get that question so many times. Now, Amiee, I also know that your coding and billing company does what it's supposed to do, and that's reads the documentation for every patient encounter before you submit a claim for that encounter. Now, with the growing number of physicians and qualified healthcare professionals adding wound and ulcer management to their practices, and the growing number of mobile wound and ulcer management companies, what is the biggest challenge that your billing company encounters?
Thank you for that question. The biggest challenge that my billing company faces is a plethora of well-meaning professionals who are either they're adding the wound or ulcer management to their practice, or they're accepting new positions with wound and ulcer management companies. Many of these professionals do not understand the fundamentals of conservative wound care, such as appropriate wound dressings, diagnostic tests to help rule out underlying conditions that affect the healing process of the wound, the standard of care for the different wound etiologies, the plan of care development, appropriate product selection, such as the surgical dressings or the appropriate use of products and procedures such as debridements, offloading, and compression, the negative pressure wound therapy, hyperbaric oxygen therapy, and the application of cellular and/or tissue-based products for skin wounds, and applications of the platelet-rich plasma or other blood-derived products, patient education, and so forth. This is important to my wound-specific billing company because we should not submit a claim unless a medical record for each encounter contains the documentation that supports the coverage requirements for the codes that the professionals want us to submit to the payer. We always know when we are working with well-trained wound and ulcer management professionals by their compliant documentation and their code selection. Those professionals who are untrained often argue with us when we tell them we cannot report the codes that they request because our documentation does not support the medical necessity for those codes, or we get questions on why documentation requires specific details for those services.
Well, thank you, Amy, and subscribers and listeners. This is a very important piece that you really should be sure that if you're not doing your own claim submission and you hire someone, that they are actually reading your record before they submit the claim. And in fact, if they're your own coders and billers, they should also read the record before they submit the claim. So thanks, Amy, for sharing your hurdles that your company
Welcome.
experiences when professionals do not have adequate wound and ulcer management training, when they don't understand the coverage requirements, and when they do not understand the coding guidelines and the payment regulations for the work they perform. Will you please share the type of training that wound and ulcer management professionals should have before they begin providing wound and ulcer management to patients and submitting claims to providers?
I'll be glad to. There are several organizations that offer wound and ulcer management certification courses, such as the American Board of Wound Management, the National Alliance of Wound Care and Ostomy, and the Wound, Ostomy, and Continence Nursing Certification Board. Once professionals have their certification, they should be committed to maintain their knowledge about the latest wound and ulcer management advancements. They can achieve that by attending one or more of the clinical symposiums that are held throughout the country every year. SAWC is one of them. In addition to maintaining their clinical knowledge, wound and ulcer management professionals should learn the rules and regulations about appropriate coding, coverage, and payment before they see their first patient. They should be committed to maintaining their reimbursement knowledge. This is important because the reimbursement rules and regulations can change from year to year. Wound and ulcer management professionals can gain and maintain reimbursement knowledge from a wide variety of webinars and newsletters that are offered by their Medicare administrative contractors, the Centers for Medicare and Medicaid Services, the American Medical Association, their professional societies, and by wound and ulcer management reimbursement strategy and education consultants like yourself. Even billing companies like mine must maintain our knowledge. In fact, Kathleen, whenever you are speaking at a symposium or are offering a webinar, I always attend. And I always tell my clients about the excellent customer virtual education classes that you offer on coding, coverage, and payment. I learn something new from you every time on one of your webinars.
Well, Amy, thank you for those kind words and for doing two things today. One, for sharing why it was important for professionals who provide wound and ulcer management to have the clinical expertise required to obtain excellent clinical outcomes and to paint the picture of their work through their documentation in each patient's medical record. And two, why it is important for the professionals to understand the coding, coverage, and payment rules and regulations before they begin seeing patients. Your truthful answers should help our subscribers understand why billing companies are handicapped when the place of service, the scope of practice, and reimbursement rules and regulations are not followed. Now, a special thank you to the subscribers for listening to this episode of Reimbursement Readiness Business Tips for Wound Practice. Please listen to the next episode when I will continue interviewing Amy about the credentialing process that wound and ulcer management professionals must complete before billing the patient's payers. Amy and I look forward to talking to you soon, and thank you for listening.